Happy Friday, Baylor College of Medicine and friends of Baylor. I'm going to start off by apologizing to my sister because we have a little science to go over this week. Lots of stuff happening. First thing is a big shout out to the viewers from Cuba and Australia who don't like the fact that I haven't mentioned them in the world map. So the world map's pretty much the same on fire, but Cuba is doing very, very well because they have one of the highest percentage of vaccination. And Australia, as our friend pointed out, is also doing pretty well, but just one correction. They report 92, 93% of their population vaccinated, but actually they talk about it as the eligible group. The virus doesn't look at eligible. The virus looks at the total population. And they're not doing any better than the United States, which is one of the reasons why they're still on fire. Cuba's doing very well, 93% vaccinated. China's 88%. Russia, not doing well. They've got 50% of their population vaccinated because Russians don't trust their vaccination, their vaccines, the Sputnik. Australia, about like the United States in the 80s. It's interesting, I like to look at Austria and Israel because they're about the same, 74 and 72%, but they are taking very different approaches to how do you handle this. As you know, Austria just voted on Thursday to make COVID vaccines mandatory for everyone 18 and over. So they are mandating vaccines, which I think is going to be effective. Israel keeps just giving boosters over and over again to the same people who've already been vaccinated. And the problem is they still only have, 70% of the population vaccinated. 30% is a huge number, and that's why they're having a huge spike. The Italian government is trying to do more like what the Austrians have done. They've made it mandatory for people over 50. And they've made pretty harsh limits on if you're unvaccinated, you can't enter businesses, including banks, post offices, and some stores. And in Australia, I give them a lot of credit. They're pushing people to get vaccinated, electively. But I think kicking Novak out of the Australian Open is exactly the right thing to do. And by the way, it's good for Rafa. Rafa's doing pretty well. He might actually win, thanks to kicking Novak out. The United States, you'd think we'd be doing better. Public, health used to be something that superseded individuals' personal choice. But apparently the Supreme Court, has struck down mandates for large businesses, and the New York Supreme Court struck down school mask mandates. So, if you can't vaccinate everyone, so how do you get this over? Well, you can do what's happened in South Africa. Herd immunity the hard way. You have this giant spike and come down. And that really is herd immunity because they only have 28% of the country vaccinated. So you got to see what happens in a population that's unvaccinated. Huge spike, and then a rapid decline. Unfortunately, a lot of morbidity associated with that. And we're kind of a mix of a combination of half the population vaccinated, in our case 60%, and 40% not. And what you can see is, look at the spike in Israel. This is because they haven't been able to get 30 to 40% of their population vaccinated. Now, the United States and the United Kingdom are coming down, and you can see we had a very rapid spike up and we're beginning to come down. But because we're such a large country, it's not the same in every part of the country. So the Midwest is still peaking, and it'll just start to come down. Northeast is doing better now because it had a big spike. West Coast doing a little bit better. But if you look at the national map, it's still huge amount of virus around. Now, one of the most interesting things that's happened is if you look at the difference between vaccinated and unvaccinated, if you're unvaccinated, you're twice as likely to get infected as people who are fully vaccinated. But it's narrowing because the vaccines are really good at preventing serious illness and death, but they're not so great at preventing infection. And we've talked about this. A lot of people who have been vaccinated are getting breakthrough infections. Although they're mild, they're getting infected. And the interesting thing, it continues to be a huge difference between the older population and the pediatric population. There is a huge increase in the number of COVID-positive patients in the New York hospitals, if you look at it, but the total number of admissions isn't changing. And the thought there is that the kids are being admitted with COVID, not necessarily because COVID. Whereas adults are getting COVID, especially unvaccinated adults, are getting COVID sick and being admitted to the hospital. And so there's a difference in the severity of the illness in the pediatric population. And this is shown actually in a really interesting study from England, France, and Spain, where they looked at the divergence between admissions and cases. And if you look in kids, the admissions and the cases are perfectly parallel, whereas in adults, cases are disparate from admissions. And the thought there, again, is that kids are getting admitted with COVID, and so they're parallel, whereas adults, there's a lot of cases where people are vaccinated or staying out, but if they're unvaccinated, they're being admitted to the hospital. Texas, we're beginning to see the urban centers drop. It's still very hot in Texas. And here in the Texas Medical Center, finally we're coming down, still incredibly high numbers of cases. So last week we averaged 9,000 per day, down from 13,000. But still, remember, the good number we're looking for is 200. And daily average of hospitalizations was down to 400 from 487. So what is the problem? I mean, the problem's always the same. People have to get vaccinated. So what are the barriers to vaccination? There's a really interesting Kaiser Family Foundation survey that basically pointed out that 8 in 10 people believe one of the total falsehoods that are around. And so if you look at this survey, where navy blue indicates that people have heard this from a friend and believe it to be true, this is the kind of thing we're up against. 38% of the people think that the government is exaggerating the number of COVID-19 deaths. Actually, we've gone over data that looked at excess mortality. If anything, we are vastly underestimating the number of COVID deaths. So, and a third of the population believes that somehow we're purposely exaggerating the number. 17% believe pregnant women shouldn't get COVID vaccines. 8% still believe it causes infertility. 14% believe that you can get COVID from the vaccine. So, it's a battle trying to get the correct information to people, but I keep believing science will win. Science isn't winning yet, but we're going to win. We're going to win in the last quarter. So there's a lot of interesting science that came out this week, and this is good news for those of you who've been vaccinated and had a breakthrough infection. You get a pretty significant boost in antibodies responses to all the different viruses if you've had a breakthrough infection. You can see in the gold there versus the blue bars. But more importantly, the biggest difference, and I think this is really important, is that you get a giant spike, an increase in your IgA. IgA is the antibody that's in your mucosa that prevents you from getting an infection. And that's the problem with an IM injection. You don't get much of an IgA response. And so that's why people are very protected when they get vaccinated, because they have all these other antibodies, IgM, et cetera, and IgG. But the IgA is what protects you from getting a mucosal infection, and that's where we really need it. So I think future times of vaccines need to focus on that. There's a really good study that looked at whether or not you could actually improve, with a third dose, improve responses in terms of preventing you from going to the emergency room or hospitalizations. And with a third, the booster shot, it's really impressive. You go from 38 to 82% protection against Omicron by getting a third dose, and that's against emergency room encounters. And you go from 57 to 90% protection from hospitalization. So huge benefit from getting a booster, which is why I personally feel to be vaccinated really is a 3-dose regimen. I wouldn't say that you're up to date. I'd say you're vaccinated at that point. And there have been some studies that just did this was from the Commonwealth Fund, just did an analysis. If we could get more people boosted, increase the number of boostings before April, we could probably, if we doubled the number of boosters that were taken, we could save 41,000 deaths. And if we could triple the number of boosters, we could save 63,000 people. So we need to get the message out. And I sort of think the CDC and everybody should be pushing this, but you need to get that third shot, that booster shot. And why is there such a big difference between those who are, getting infected and the unvaccinated versus vaccinated, particularly around serious illness? Well, we don't talk a lot about the CD4 and CD8 response, but you get a huge CD4 and CD8 response with vaccination. And so you have this, you have this immunity that's in there. Your memory immunity is there. And so if you do get infected, at least your body's going to respond much more quickly. So it's really important that we get vaccinated. And then there was a study that came out of the weekly review from CDC looking at this very serious multi-inflammatory syndrome in children. We talked about this with Dr. Gordon, the chair of pediatrics. and the physician-in-chief at Texas Children's. And she pointed out this is a very serious illness. There have been some deaths in kids with this, and vaccination prevents, it's 91% effective at eliminating that complication. So again, a very important reason for you to vaccinate your children. So what's new with the variants? It's amazing how Omicron has just taken over. Remember our old friend Delta? It's gone. Basically, Omicron's taken over. It's 99% of the virus out there. Last week, there was a real intriguing story that there was a recombination, something that looked like Delta and also looked like Omicron, and a Greek scientist termed it Deltacron. Turned out that wasn't a real story. That was in Nature. In January 7th, the virologist at the University of Cyprus identified unique virus. He posted 52 sequences, and a bunch of people looked at them and realized they were either contaminants or a mistake in sequencing. So that is not really a story. If you hear about Deltacron, it doesn't exist. Or it hasn't been proven to exist. There is a second version of Omicron on the way, though. It's called BA.2, whereas Omicron's BA.1. That is spreading quickly. It's been detected now in 40 countries. It is slowly replacing the original Omicron in India. There are 100 cases have been detected in the United States and in 20 states. And it's called the stealth Omicron because it lacks a particular part of the previous one that we picked up by testing. So we don't pick it up, and so they called it stealth. We don't know how bad it is. We'll have to wait and see. There's no evidence that it's worse, or it may be more infectious because it seems to be taking over for some of the original Omicron. But we'll have to wait and see. Hard to believe something's more infectious than that, but we'll wait and see. And because the spike protein keeps changing so much, the monoclonal antibody infusions aren't as effective. And the FDA just came out and said the monoclonal antibodies that Regeneron and Eli Lilly make are ineffective against Omicron. The GlaxoSmithKline one still appears to be effective, but it's very hard to get. And the Pfizer antiviral pill, Paxlovid, is still probably going to be effective against Omicron. We're just waiting for it to be more widely distributed. And then here's some news that just the most unlucky of pet store owners. This poor guy in Hong Kong, the little pet shop, he had a customer that developed Delta variant coronavirus. And unfortunately for him, 11 hamsters also tested positive. So among our animals that we know get coronavirus, now apparently hamsters. Poor guy had to close his entire shop. He's out of business. It's bad when your hamsters get coronavirus. And now, for my favorite time, the Winter Olympic update. We love the Winter Olympics. China is doing their best to repeat do it better than Japan, but we'll see. As I mentioned to you last week, they've created this closed loop system. They're testing everybody. They're putting everyone in a bubble. Everybody's going to be required to be vaccinated, good for them, and they will be required to be tested every day, and then they have a whole process for isolation. They just announced that Bing Duen Duen is a panda, is the official mascot of the Winter Olympics. Apparently has several meanings. The most common is ice, but it also symbolizes purity and strength, while Duen Duen means robust and lively. I took the liberty of adding what I think is going to be the next Winter Olympic Games. It's going to be wearing a little bit of coronavirus. But we'll see, good luck with that. We'll see how it goes. Anyway, a bunch of shout-outs this week. PLOS Biology released a list of the top 2% of scientists most frequently cited worldwide. Baylor College of Medicine and over 250 researchers on the list. And our top 3 were Joe Jankovic, Hashim El-Sarraj, and David Graham. So congratulations to all 250 scientists and those 3 in particular. Also, we had 2 new fellows elected to the American Association for the Advancement of Science out of the 564 new fellows. Dr. Christoph Herrmann, who's a professor of molecular and human genetics, and Dr. Young Lee is a professor of medicine in epidemiology and population science. So congratulations to all of our outstanding scientists. And just want to announce one important new addition to the Klotman family, J.P. Klotman, my new grandson. So have a great weekend. I can't wait to see you next week.